Welcome to The Explainer. Today, we're jumping right into something that can go from mild to life-threatening in just minutes, a severe allergic reaction. Knowing how to spot those dangerous signs and exactly what to do next, well, it's more than just helpful. It can literally be the difference between life and death. So let's get you the facts you need to act. All right, so picture this. You see someone, maybe a friend, with some hives popping up and a swollen lip. What's your first thought? Oh, just grab an antihistamine? Or is this a call 911 right now kind of emergency? That line between a small problem and a huge crisis can get real blurry, real fast, and that's exactly what we're going to clear up today. Okay, first things first. We need to think about allergic reactions as being on a spectrum. On one end, you've got some minor, localized stuff. But on the other end, you have a full-blown body crisis. Understanding where a reaction falls on the spectrum is absolutely the first step to responding the right way. So on the milder side of things, you have what's called a non-anaphylactic reaction. This is when the body's little alarm system is kind of contained to one specific area. So you might see hives, for instance, but only hives, or maybe some swelling in one spot, but their breathing is totally fine. The key thing here is that it's localized. It's usually affecting just one body system, like the skin. But what happens when that small, localized alert suddenly becomes a full-blown, body-wide, 5-alarm fire? Well, that's when we cross over into the danger zone of anaphylaxis. And when that happens, the rules of the game change completely. And yeah, the difference is huge. Anaphylaxis isn't just a skin problem. It's a systemic crisis where multiple parts of the body are freaking out at the same time. We're talking about someone's airway closing up or their blood pressure dropping so low it leads to shock. And that is the critical difference. Unlike a mild reaction, this demands immediate epinephrine. Okay, so here is the million-dollar question, right? How do you actually know when that line has been crossed? How can you recognize anaphylaxis when it's happening right in front of you? Well, thankfully, there are some really clear guidelines, and they give us a checklist to follow. All right, let's break this checklist down because it is so important. There are basically two main ways to identify anaphylaxis. The first one is the most obvious and the most severe. If you see someone suddenly get sick and they have either any trouble breathing at all or a sudden drop in blood pressure, like they faint or feel like they're going to, if you see that, it's anaphylaxis, full stop. The second way is all about the combination. If those really severe signs aren't there, you look for a combo of two or more of these other symptoms from different body systems happening at once. So that could be hives plus vomiting, or a swollen tongue plus stomach pain. You see that combination, you have to assume it's anaphylaxis. So the second you recognize those signs, there is absolutely zero time to waste. Your response has to be immediate, it has to be decisive, and honestly, there is only one correct first step. Look, if you remember just one single thing from our entire explainer today, please let it be this. When it comes to anaphylaxis, it's epinephrine first, and it's epinephrine fast. Nothing else comes before it, not an antihistamine, not an ice pack, not calling a friend for advice. Epinephrine first. So what is this stuff actually doing in the body? Well, you can think of epinephrine as a powerhouse medication. It works almost instantly to reverse the reaction. It kicks the heart into gear to raise blood pressure out of that danger zone, it works to open up the airways by reducing the swelling, and it slams the brakes on that massive release of histamines that's causing the whole crisis in the first place. And the action plan itself is incredibly simple. This slide just lays it out perfectly. Step 1, give the epinephrine immediately. Step 2, inject it right into the outer thigh. That's key for getting it to work fast. And step 3, which is probably the most important rule of all, do not delay. For any reason. Don't wait around to see if things get worse. The moment you recognize the signs, you have to act. Now you might be wondering, why the thigh specifically? What's so special about the thigh? Well, it's all about one thing, speed. When you inject into that big muscle in the thigh, you get the fastest possible absorption. That means you get the highest concentration of medicine into the bloodstream where it needs to be, as quickly as possible. An injection in the arm, it's just way, way slower and is not the first choice. And here's something you have to remember. One dose isn't always a magic bullet. The effects of epinephrine can actually be pretty short-lived, and that allergic reaction, it can try to come roaring back. So you need to be ready to give another dose every 5 to 15 minutes if the symptoms aren't getting better or if they start to come back. Okay, now we need to clear the air and bust some common and, frankly, some really dangerous myths about treating anaphylaxis. Believing this stuff can lead to fatal delays. This slide is so critical because it just cuts right through all that bad information. Let's run through it. Myth number 1, give an antihistamine first. Fact is, antihistamines are way too slow and they simply can't stop an airway from closing. Next myth, steroids will stop the reaction. Nope. They might be used way later in a hospital, but they do nothing in the immediate crisis and must never delay the epinephrine. And finally, maybe the most dangerous myth of all, let's just wait and see if it gets worse. The hard fact is that with anaphylaxis, any delay in giving epinephrine can be fatal. Every single second counts. And look, the official medical guidelines could not be any clearer about this. Yeah, other medications like antihistamines and steroids might be given later on in a hospital, but they are secondary. They should never, ever, under any circumstances, get in the way of giving that first and most critical treatment, which is epinephrine. Okay, so you did it. You recognized the signs, you administered the epinephrine, and the person seems to be breathing easier. That's great. But hold on, your job is not done yet. This is a hugely important point, so really let this sink in. Epinephrine is not a cure. It's a rescue drug. Think of it like hitting the pause button on the crisis. It buys you precious time by temporarily stopping the symptoms, but it does not make the underlying allergic reaction just disappear. And that is exactly why this next rule is completely non-negotiable. Every single person who receives epinephrine for anaphylaxis must be transported to the emergency room. I mean it, no exceptions. Even if they feel 100% better, that reaction can come back hours later, and they need to be under medical observation. So let's lock in everything we've learned with these 4 simple R's. Think of this as your action plan. First, recognize the signs. That's any trouble breathing or 2 or more symptoms across the body. Second, respond immediately with epinephrine in the thigh. Third, reject the myths. No antihistamines or steroids first. And finally, react by making sure that person gets to the ER right after the injection. You know, understanding all these steps isn't just about learning some facts. It's about empowerment. Knowing how to recognize anaphylaxis and how to respond without hesitating gives you the power to act confidently in a crisis. And that knowledge could absolutely save a life.